Hi, welcome back. Basic anatomy. So what we're going to do is we're going to go through a few steps. We're going to do the skeletal system, we're going to do the muscular system, and then we'll do some flesh flesh overview. I have in the homework a bonus section if you want to go ahead and draw the internal organs where they sit in the cavity, so you'll know, because you might want to show them later depending on the damage that you put on your zombie. So I don't want to spend too much time here. What we're really looking to do is just uh, group the bones and the muscles into the larger groups, so that we're really looking for bones, especially we're looking for the big bones, the bony landmarks that you're going to look for when you're doing the drawings. Same with the muscles. We're not going to get into the nitty gritty of all the teeny tiny muscles. We're just going to look at the major muscle groups. The basic anatomy sheet that I gave you already has the bones on it, but I'm going to go through them with you anyway, just so that we can get the drawing down and you get familiar with how they go together. And I did this just for speed more than anything else. But you should take the time and learn to draw the bones and how they connect. And let's go ahead and get started. So I don't want to spend a ton of time going through all the little bones, like I said. I think it's a little bit more important that we go through some of the major groups. So when we'll start up here. Give me another layer here. I'm going to start up here on the skull. So when we're talking about the bones in the skull, you really don't need to get into all the little ones, like you're going to want to know where the temporal bone is, the parietal bone, the occipital bone, in just their general location. Whether you are going into where they actually go together and what the connections look like is up to you. So, for example, if I was going to draw the occipital bone, I would draw the parietal bone is on either side here. Then the occipital bone is this large bone in the back of the head, and that connection is a zigzaggy line, kind of does that. So, but this is primarily where the spine attaches, the thoracic spine, or the cervical spine. I'm sorry. So your cervical spine, you're going to have 7 bones in the thoracic, or in the cervical. I'm sorry, cervical. The thoracic doesn't start until down here. So we'll put a C here for cervical. You're going to see the back side of the lower mandible, the jawbone, basically, from the rear. When we get to the front, we'll go into a little bit more about the mandible and how it connects and where it connects. So we want to make sure that we're drawing all of the groups of the spine together, because then you, like I said, you've got the thoracic. The thoracic, think of it as like an insect. Your thoracic region, your thorax is if you think of an exoskeleton of a insect, it's where they do the breathing. So that's why we've got the thoracic region is the region that's attached to our rib cage. So we're just going to go by region as we're putting this together. So then you've got your lumbar, and if you're wondering why the shape I've got going on here for these is, so on the end of each one of your vertebrae, you've got these little tails that stick out like this. So I'm just grouping those as part of the shape. And then you've got the same thing, you've got the spinal ridge, that you've got all these little bones that stick out coming towards you as well. So I'm just grouping them together as one large shape as opposed to having you draw each one. So if you've ever had an x-ray of your back and you heard the technician talk about your Scotty dogs, so that's these little bones on the side. In your x-ray, they look like the head of a little Scottish dog, so that's what they're referring to as your Scotty dogs. Then we go down into the hip. You get the sacrum and your tailbone. I'm just going to put those together as one piece, just for the sake of what we're doing here, because it's not really important right now that we separate those into pieces. Your rib cage actually starts way up here. So you've got that, your first rib sits actually up above the scapula, not underneath it. We need to go over the difference between a male and a female rib cage when we're actually drawing them. There's a few important things to remember here. So when you're drawing, like the difference, I'll bring this up here so I can show you up here. The difference between a male and a female rib cage when you're drawing them. So the male rib cage is going to broaden out a little bit more at the bottom. In your sternum. And then down here, I mean, these are actually your floating ribs down here. Your spine is running through down here at the bottom, and then you've got the ribs all attaching in here. The sternum is sitting up here. I'm not really concerned right now with the number of ribs or anything like that. It's for what we're going to do. It's kind of irrelevant because unless you're drawing a skeleton, that's pretty unimportant. But what is going to be important for you is that shape of the rib cage for your drawing between the male and the female, and I'll show you why here. So when we're drawing the female, she's going to be much more of an oval shape in the ribs. Men and women are built very differently and for specific reasons. So when you're talking about the ribs in particular and the difference between them, so when you're overlaying the muscle groups on top of this, so like I said, the sternum is going to sit in here. Now the pectoral muscle for one. So the general shape is going to be the same of the pectoral muscles, but the males are much larger. So this spacing here, where this pectoral muscle is going to sit, and the pectoral muscle is kind of a fan that's going to connect. And it kind of crisscrosses into the deltoid. Now, the difference being is when you draw like the latissimus dorsi, as it comes down, it's going to give the male that much bigger V shape from the bottom. And then you've got your abdominis erectus, abdominal muscles that sit in here, and you're getting that very beefy, broad shape that you're looking for when you're looking for a male. Now that's not to say that every male's rib cage is exactly the same. They are not. I'm sure you've seen lots of guys that are just enormous and you wonder what they've been eating, and other guys that just are average or smaller, have a more petite frame. That's just a genetic thing, but if you're going to do it by just generalizations, this is really what you're going to be looking for here. Now the female, it's very similar, except the pectoral muscle sits a tiny bit higher. It is much thinner, and what you're going to be seeing here is this space for the latissimus dorsi, the lat muscle, and it's going to come down into here, is going to be smaller. They're simply not built to carry the weight that men are and to have the upper body strength. So these muscles and their attachments and where they go are going to be smaller. And then you've got the breast tissue, the fatty deposits that sit on top of this that actually make that female shape. And then you've got the abdominis rectus that comes in here, and the lateral oblique. But then as you move down, I'll show you over here, the hip bones for the male and the female are very different. The male's hips, so let's go through this really quickly. So when the ilium, the pubis, and I always say this one wrong, ischium, they call it a pelvic girdle, is going to be much higher. I say much. It's taller and it's thinner than a woman's. And this right here is the reason why. Then you've got the tailbone that comes in. Let me show you this. So in a male, this is the pubic bone here, and it's connected with a piece of cartilage here. If anybody's ever broken that or cracked it, your body collapses like a house of cards if that bone ever separates or breaks. This is where the humerus, the head of the humerus, or the head of the femur bone sits, and then it has that hammer shape that goes down. So, like I was saying, the reason why that the male and the female pelvic region is so much different is, again, kind of obvious. It goes back to the childbirth and the canal, where the birthing canal. So in a male, you've got this kind of a heart shape here. Okay. In the female, it's a large oval shape to allow the child to move down through. So it's a really quick indicator if you're looking at a skeleton as to finding out whether it was a male or a female. That is the fastest way to look and see, is the height, the width, and the shape interior. If it makes that giant oval shape, it is definitely a female. I'll just go through these really quick. Now, the shape of these bones has other meanings too. So when you look at a male skeleton, the legs, the femur bone that sticks out of the bottom of it, is going to be much more vertical on a male. The distance here to where the bone sits, this is going to be a much more vertical position on a male skeleton for the femur bone. On a woman, you see this is a steeper angle, so that bone sits at they call it the Q angle of the hips. And you never really want to draw those straight because these bones kind of twist as they come down to keep the center. So you're looking at this, that Q angle of the hip makes this bone come in at an angle to keep the center of gravity over, basically keep your balance. So that's why you'll see like that you get that hourglass shape with women because their hip bones are shorter and wider, and it puts the femur bone at a much steeper angle. So these little differences are really good to familiarize yourself with, just so on the fly when you're doing your drawings you can make the necessary adjustments between male and female, and it's just going to make your life easier in the long run if you understand these differences and how they work and why they work. All right, go back down here into the skeleton. Now that we have these, we've gone over the basic differences between the two. So this is the AC joint. That's made up of the clavicle, or the clavicle in the front, the scapula in the back, and the humerus bone. And when you're drawing bones, the bones like the humerus and the femur, it's a ball and a socket. So what that basically means is you're going to have these three bones meet. The clavicle is that top bone that you feel on your shoulder up here. The clavicle that sits behind it also has that spine ridge, but then it's got this little socket piece on it. And then the head of the humerus is a ball that sits in that little space made by the clavicle and the scapula. And then the rest of the bone comes out and will come down. Now sitting around that, you've got the muscles of the rotator cuff, and you've got what's called a labrum. Your labrum is a cartilage ring that circles this bone and it holds it in place. So anybody that has a tear in their labrum, what happens is you'll get, if you have a tear in your labrum, what that does is it allows the head of the humerus to move in and out because that cartilage ring is what holds it tight into that little space. And those three little muscles of the rotator cuff are all that's holding your shoulder together, basically. So when you tear your labrum, it allows laxity and allows the head of that humerus bone to slide in and out of its socket, and it causes a lot of pain. I was a gymnast, so I don't have a labrum in either shoulder anymore, so I'm very familiar with what that feels like. But going on from there, again, the scapula. There's the little spine of the scapula here. Now, when you're looking at it, when we start talking about the muscles, you'll see where these ridges, like the spine of the scapula, is really important because your trapezius and other muscles and groups are going to attach directly to it. And anybody that's ever banged their elbow back here and they say you've hit your funny bone, I know it's such a dad joke, but I'm a dad, so I'm allowed. It's called the funny bone, not primarily because it tingles when you hit it, but because it's the end of the humerus bone. Now, when we're talking about, when we get down to the hands, when we draw the hands a little bit more, primarily when we get to the fleshy part. So the carpal bones are this group of bones in your wrist here. Carpal, meaning fingers, basically, meaning hand. Tarsal are down here. Tarsal, meaning foot. So when you hear metacarpal bones, you're talking about your hand bones. Metatarsal bones are your foot bones. So again, I'm not going to really concern myself too much with the bones in the hand right now. When we start drawing flesh, we'll get a little bit more into detail on them. And then thumb. So, I mean, the only thing that you really need to know about these bones down here is the basic shape that they're going to make. You can get into the nitty-gritty on them if you'd like, but for what we're doing right now, it's not really that important, so I'm not going to worry about it too much. I'm going to go through getting the hips drawn in pretty quickly. So the other thing that we need to remember when we're drawing the pelvic bones is that the little loops that you see in the back, these little guys down here that you see, where they sit. So the actual pubic bone is in the front. So that's this guy here. This guy's in the front, and we're drawing the back. So as the bone comes down and wraps around, this little loop that you see hanging down here is actually in the rear, moving forward to the pubic bone. So it's just when you're drawing it, it's just the easiest way to remember where or the orientation of that bone. This is the femur bone. Like I said, we want to avoid making these bones perfectly straight. They are not perfectly straight, and they turn and have little attachment spots on them for the muscles to attach. And if the bones are completely straight, you're going to have trouble making the muscles look right when you put them on. There's not going to be a ton of movement in them, so it's not like they're going to have this giant bow to them. And hey, then you've probably seen people that are extremely bow-legged and they look kind of funny when they move. But they are not perfectly straight on anyone. I forgot to go into, so your radius and your ulna. The way to tell them apart is the ulna is the one that makes the point of your elbow, and then the radius is the other one. So it's a real quick way to remember which one is which. And again, got your carpal bones. You see I'm kind of grouping all of these together too, because these are what's making up the palm of your hand, and it's more the shape of that we need to concern ourselves with more than the the bones themselves, and you got the fingers. And when you're setting these up, and you're setting up your skeleton, some of the things you want to look for is this bottom peak in the rib cage is going to line up basically with the elbow. The base of the middle finger is going to be just below the center line in your humerus, or I'm sorry, your femur bone. It's funny, I keep getting the some of these bones mixed up. I used to teach anatomy to artists, but it's been a long time, so I'm a little rusty on what they're called. Still remember where they go, but the names of them start to blend together if you don't recall them regularly. All right, so the lower leg, the tibia, is the larger of the two bones. The fibula is the shorter, or the skinnier of the two bones in the lower leg. And then the tarsus bones, the tarsus, meaning foot, heel bone, and there's your pinky toe. Again, not super important to remember all these bones for what we're doing, more remembering the shape that they're in. All right, so now we'll move on to the side where we have the same thing. So remember we were talking about the parietal bone and the temporal bone. So the temporal bone is this. The parietal bone is here. Your occipital bone is back here. Like I said, you don't really need to know all of that, other than knowing where they are is useful. This is the upper mandible, cheekbone, orbital bones, the eye socket, and the lower mandible. In the male, it's going to be a much more squared off chin. It sits there. When you're drawing a female, this squared off ridge here is gonna swoop in without that point on the end of it, and generally here as well, it's gonna stay much smoother and not have those squared off pieces. And again, the 7 cervical bones before they go into thoracic, and then lumbar is down here. The clavicle is a curved bone that goes into the scapula. This is that little socket bit that I was talking about, that where the humerus sits, and that's that spinal ridge on the scapula where the trapezius muscles attach. sternum, ribs. So when you're talking profile of the rib cage, you've seen some people that are very barrel chested. That just means that their sternum sits out further, and there's a larger flare at the bottom of the rib cage. Generally, men are much more barrel chested, if you've seen that, than women are. Your thoracic spine. Let's draw a little dotted line in here, because this curve that comes through here is really important. People that have a lot of back problems are missing, and then you've got the little guys that stick off here, are missing this curve in that lower lumbar region. And those people generally have a ton of back problems. The other thing that you're going to see that is missing in a female skeleton is this little guy. Everybody knows what that is. That is the Adam's apple. That is a bone in the male skeleton. You've got your hip bone, your pelvic bone. That's the head of the femur. And there is your tailbone. Kneecap that is attached to the patella tendon that runs down and connects your upper and your lower leg with your ACL and your PCL and the meniscus and all that stuff. But knowing that the kneecap actually sits at the bottom of the femur as opposed to really floating the gap here, because there's the tendons are what come down here, but the bone itself sits there. So when you're drawing knees are another thing that are a lot of times are really problematic for people to draw, including myself. Depending on the position of the body, a lot of times the knees are a struggle to get right. Here's where it's a little bit more important to know the tarsal bones. And again, we're going to primarily concern ourselves with the shape. So if you've ever seen like a ballerina point their foot, these bones here do spread apart some, but not much. But there's actually a joint here, and then you've got the joint here. So if you've ever seen a ballerina point their foot, it bends down, and then it bends down again, and you'll have the toes, and the top of their foot has that bend in it, and then the ankle bone and everything comes from there, and then it goes up. But that bend in the foot there is actually right here. So if you've ever wondered why or how their foot bends there, when a lot of people's don't, they've worked on the flexibility in this joint here. Drawing feet is another thing that people have a lot of trouble with. And feet can vary so much from person to person. I mean, you've seen some people that have the long monkey toes, and you've got others that have just these little flipper of toes that don't seem to work very well. Surprisingly enough, there's a lot of people that really struggle with skulls as well. Just the general shape and where things are. like the opening for the nasal cavity, where it sits, how low it sits. Brow ridge will be much more pronounced on a male than it will be a female. So I know we're going through this pretty quickly, but it's a good brush up on where things are and how they connect together, especially when you're doing something like zombies, like we're drawing today. The understanding how these bones work together and connect is going to be really important for you, because if you're going to be able to distort a position, or you're going to be able to show a lot of damage in the underlying tissue, you need to understand where they are, where the muscle groups are, what you're actually showing. Is that Adam's apple? That sternal notch up here is actually the clavicle. Sits up here, that attaches to the sternum. And the AC joint is on that end. This is your first rib up here. Rib cage. So if you've noticed, this is the skeleton is primarily male, although if you look here, the shape of the ribs here is, I've drawn it less exaggerated here. It is skinnier at the top, but you see the flare is actually lower at the bottom, which makes it a male skeleton. If I was going to draw this skeleton to be female, it would be a little bit wider at the top and it would narrow in more at the bottom. Thoracic region of the spinal column, lumbar region, spinal column, and tailbone. Cartilage piece that holds that together. Now, on a female skeleton, when they're giving birth, this actually separates to make this ovular shape bigger to allow the baby to move through the birth canal. On a male, that's never supposed to happen. So when it does, that's what I said, the guy will collapse like a house of cards if they ever break that bone or separate that cartilage that holds that pelvic bone together. Head of the humerus. And then back here you see the scapula kind of peeking through. Radius in your ulna. Now, if you want to go through here and flesh out these bones, and label them, this could be an actual good sheet for you to look back on, to make sure that you're putting them in the right place and remembering what they are. We'll do another one of these here in a minute that is muscular overlays, so that we know where the attachments are for the different muscle groups, which again will be, if you plan on doing any figure drawing or any character drawing that has any kind of a realistic anatomy to it, just knowing the basics of the bones and where they go is going to be extremely helpful to you. So this sheet is don't only use it for the exercise we're doing now. It's a good thing to keep around, just so you have it and can do a quick check on if you're trying to draw a position and it's coming across a little funky. It'll help you to fix that. And this is the femur bone, kneecap, tibula, fibula. I do that every time. Again, this is the femur, kneecap, tibia. See there, I got it that time. Fibula, and the metatarsals, basically meaning toes. Heel bone. That was jacked up. So this space between your big toe and the next toe over, when you're drawing feet, is actually really important, and it's gonna help you a lot, especially if you're drawing things quickly. To remember where the weight is going. Generally, the weight on your foot is going to sit on the ball of your foot right behind your big toe. Sprained ankles happen when the weight shifts to the three toes on the end that are much smaller, and it causes the ankle to roll in this direction. So, but primarily, the space between here and here is what keeps the balance, and the big toe, meaning, is where most of the weight is going to be sitting. All right, so there we have it. We've gone through the basics of the skeletal system, where the bony landmarks are. The ones you're really going to be looking for, cheekbones, the AC joint, the sternal notch sits up here, the cervical spine, thoracic, lumbar, the points of your hip bone, your ilium or your iliac crest, hips, which is the humerus, your radius ulna and humerus where they meet at the elbow, kneecap, Adam's apple, tibia and fibula where they connect, and there you go. There you have it. So thanks, and I'll see you again here in a little bit for the muscle override.